My name's Mamie Allen, and I'm an instructor here at UMA. Today we'll be discussing medical terminology, specifically the respiratory system. Are you ready? Let's dive in. As the other body systems, the respiratory system also has a set of combining forms that make it easier to identify specific structures within the respiratory system. So you'll notice the first column identifies the structure or the anatomical site, and the second column identifies the combining form. Remember, the combining form has the letter O added to the end of that word part, which is the root word. So if we took a look at naso meaning nose, and here air is exchanged during our inhalation and our exhalation. Sinuso, for our sinuses. Here mucus is produced. It also helps with the lightness of our skull and aids in sound production. Take a look at pharyngo, for pharynx. Here, air is transported back and forth between our nose and our trachea. Laryngo, for larynx. This actually makes our speech possible. Also, notice with sinus, pharynx, and larynx, the combining form is similar, which makes it easier for memorization purposes. Look at epiglotto, for the epiglottis. And here, it closes off the trachea during swallowing. Tracheo, for trachea, and here air is transported back and forth between our pharynx and our bronchi. Then we have broncho or bronchio for the bronchi, and air is transported between our trachea and our lungs. And then with our alveolo, we have air sacs that exchange gases between the pulmonary capillary blood. And then for our lungs, which is the main organ of our respiratory system, we have the combining forms pneumo, pneumono, or you may hear pulmono, such as pulmonary. The function of the respiratory system is to deliver air to our lungs, conveys oxygen from inhaled air to our blood, expels any waste products through us exhaling, and produce airflow through the larynx, making our speech possible. Take a look here. We can divide the respiratory tract into two parts. We have our upper respiratory tract, and this includes our nose, mouth, pharynx, the epiglottis, the larynx, and our trachea, and also the lower respiratory tract, which includes the structures, the bronchial tree, and the lungs. Now, the lungs located within and they're protected by the thoracic cavity. Our mucous membranes help moisten, warm, and filter the air entering the nose. Our tonsils and adenoids are part of our lymphatic system. They both help to protect the body from infection coming through the nose or the mouth. The tonsils you may also hear referred to as the palatine tonsils, and these are located at the back of the mouth or the posterior of the mouth. And the adenoids, which you may hear referred to as the nasopharyngeal tonsils, they're a little higher up and they sit behind the nose at the roof of the mouth. Here we have the pharynx, and the pharynx, which is commonly referred to as the throat, receives air after it passes through the nose or mouth, as well as food. The pharynx is made up of three divisions. We have the nasopharynx, and that's the first division, and it's posterior to the nasal cavity and continues downward behind the mouth. Then we have the oropharynx, and this would be the second division, and this is the portion that's visible when looking into the mouth. The third is the laryngopharynx, and this is the third division, which is shared by both our respiratory and our digestive systems. Our air, food, and fluids continue downward to the openings of the esophagus and the trachea where air enters. That separates to allow the passage of air and closes to assist with the sound of production. Each primary bronchus will then divide and subdivide into smaller bronchioles, which are the smallest branches of the bronchi itself. Here, we have an external view of the lungs. Note the 3 lobes on the right lung and the 2 lobes on the left lung. The illustration here shows the diaphragm is being controlled by the phrenic nerves. Notice, during inhalation, the diaphragm contracts and pulls downward, and this causes the thoracic cavity to expand. However, when the diaphragm relaxes, or during exhalation, the thoracic cavity actually becomes more narrow. Now, we use the term inhalation and exhalation, but what is it exactly? Inhalation would be the act of taking air in as the diaphragm contracts and pulls downward, whereas exhalation is the act of breathing out. As the diaphragm relaxes, it moves upward, causing the thoracic cavity to become more narrow. As with other body systems, the respiratory system also has medical physicians that specialize in diseases or conditions of the respiratory system. Some of those specialties would be an otolaryngologist, and this would be anyone that specializes in the diagnosis and treatment of diseases and disorders of our head and neck. You may hear this doctor referred to as the ENT for ear, nose, and throat. Notice when you break the word down, ot or auto meaning ear, laryngo for the larynx, and ologist for specialist or one who specializes in. We also have a pulmonologist. A pulmonologist is a physician who specializes in diagnosing and treating diseases and disorders of the respiratory system. Pulmono means lung, and ologist means specialist, or again, one who specializes in. We also have a thoracic surgeon, and a thoracic surgeon will perform operations on the organs that are inside our thorax or the chest, including our heart, lungs, and esophagus. Some medical conditions that these specialists would treat would be COPD, and that's just an acronym standing for chronic obstructive pulmonary disease. And COPD is a group of lung diseases in which our bronchial airflow is obstructed, and this makes it harder to exhale. Many times, most people suffering with COPD may have 2 related conditions, chronic bronchitis as well as emphysema. So what is chronic bronchitis? Chronic bronchitis is a disease in which the airways have become inflamed due to recurrent exposure to inhaled irritants. It could be cigarette smoke, but it can also be environmental factors as well. Now, this irritant will begin to cause a chronic coughing, make it difficult for air to enter and leave, and also increases the risk of bacterial lung infections. Now, the next condition, emphysema. This is just a progressive long-term loss of lung function, and usually this is due to smoking. Emphysema can be characterized by a decrease in the total number of alveoli, an enlargement of the remaining alveoli, and the destruction of the walls of these alveoli that remain. I thought we'd end today's lecture with going over a few of the abbreviations related to the respiratory system. Of course, one that we've seen during this lecture would be the COPD, which is chronic obstructive pulmonary disease. We also have ARDS, which stands for acute respiratory distress syndrome. If you see the abbreviation CF, this stands for cystic fibrosis. The PFT, what does PFT stand for? Pulmonary function test. The RF, respiratory failure, right? Just like that CF. We also have the URI, which means upper respiratory infection. And then we have the abbreviation SIDS, which stands for sudden infant death syndrome. Now, as you go on with today's lecture, keep in mind some of the important concepts covered. We've looked at some of the terms that are relating to the respiratory system as far as the structures itself. We've taken a look at the nasal structures, as well as the lungs, which is the major organ of the respiratory system. I wish you all good luck in your studies. Have a good day.